Chapter 9 is discussing integrative medicine and alternative therapies. Majority of the people in the United States receive most of their health care from doctors or nurses, physician assistants, and other healthcare professionals, which whom all of them practice in a medical setup like a hospital or a medical clinic or a doctor's office. Western physicians make decisions about which treatment will be most helpful to their patients based on control and scientific studies. Evidence-based treatment plans will include prescription medication and surgery or infusions and other conventional procedures and therapies. Understanding the connection between lifestyle and physical health, Western medicine practitioners are also more commonly encouraging lifestyle modification, and especially diet and exercise. And for many Americans burdened by chronic health conditions, this will be of help. Western medicine is also called allopathic medicine, biomedicine, conventional medicine, mainstream medicine, and sometimes orthodox medicine. Complementary medicine is a group of diverse medical and healthcare systems, practices, and products that are not generally considered part of the Western medicine. This holistic medicine evaluates the entire person, the mind, and seeks to heal any imbalances between those two elements. Holistic medicine views the body as a complex system that is affected of both internal and external factors. It emphasizes the body's own ability to heal itself as well, promoting healthy lifestyle changes and preferring naturally occurring remedies such as meditation and herbal medicines to synthetically produced compounds. A more spirited based individual will look for a holistic approach to health as alternative medicine treats body, mind, spirit, and emotions wholly. A more scientific-centric individual will trust Western medicine and the many 21st century technology-based advances that have been forged through this type of treatments. Many people, however, do feel that mainstream Western medicine fails to evaluate them as a complete human being. As a result of that, many people are increasingly turning to holistic medicine. According to a 2012 national survey, many Americans, more than 30 to 50% of the adults and about 12% of the children, use healthcare approaches that are not typically part of conventional medical care or that may have origins outside the usual Western practice. When describing these approaches, people often use alternative or complementary interchangeably. But the two terms refer to different concepts. If a non-mainstream practice is used together with conventional medicine, it's considered complementary. If a non-mainstream practice is used in place of conventional medicine, it will be considered an alternative. Please take a moment and stop this presentation in order to review the objectives for this chapter. We'll discuss now the medical systems, and Western medicine focuses on pathology and curing disease, while alternative medicine focuses on the health and healing of the person. Most people in the United States and European countries turn to practitioners who embody traditional Western medicine for treatment of diseases and episodic care when symptoms arise. That is not necessarily the case in other areas of the world. There are older medical systems that have had their origins in ancient cultures in Asia, such as India and China, and even in North America prior to its settlement by Europeans. Each of these world areas has developed medical systems that are quite different from Western medicine. The alternative medical systems, often called Eastern medicine, are more holistic in their approach. It's based on the belief that health and wellness depend on the delicate balance between the mind, body, and spirit. Its main goal is to promote good health, not fight an actual disease. But treatments may be geared towards specific health problems if needed. Integrative healthcare often brings conventional, and complementary approaches together in a coordinated way. It emphasizes a holistic, patient-focused approach to healthcare and wellness, and often including mental, emotional, functional, spiritual, social, and community aspects. And by doing that, treating the whole person rather than, for example, one organ system. It aims for well-coordinated care between different providers and institutions. The use of integrative approaches to health and wellness is a trend that has grown within care settings across the United States, and researchers are currently exploring the potential benefits of integrative health in a variety of situations, including pain management for military personnel and veterans, relief of symptoms in cancer patients and survivors, and programs to promote healthy behaviors. Take a look now at some of those alternative medical systems. We'll start with the Ayurvedic medicine, and Ayurvedic medicine has its roots in India and is the oldest system of medicine in the world. It is based on spiritual practices that developed among Tibetan monks. Those who practice Ayurveda believe every person is made out of five basic elements, all of them found in the universe. They are made out of space, air, fire, water, and earth. This combined in the human body to form three life forces or energies called doshas. They control how your body works. They are Vata dosha, space and air, Pitta dosha, fire and water, and Kapha dosha, water and earth. Everyone inherits a unique mix of the three doshas, but one is usually stronger than the others. Each one controls a different body function, and it's believed that your chances of getting sick and the health issues that you will develop as a consequence of that are linked to the balance of your doshas. The object of Ayurvedic medicine is to help persons become unified with nature, to develop a strong body, clear mind, and tranquil spirit. One belief is that the prana, or the life force, moves through various centers in the body that are called chakras. The Ayurvedic practitioner prescribes modalities such as yoga and herbal medicine, fasting and eating cleansing food, meditation and massage to maintain or restore the dynamic flow of the prana. Although the term Chinese medicine is used, this medical system also includes contributions from Japan, Korea, Vietnam, and other Southeast Asian countries. Chinese medicine proposes that health is the outcome of balancing yin and yang, the opposite forces that must remain equalized to maintain qi, life's energy force similar to the prana in Ayurvedic medicine. Forces that alter the qi, either by depleting or obstructing it, cause an illness. Correcting an imbalance between two attributes such as motion and stillness or hot and cold will restore the harmony and the health. Treatment measures such as acupuncture, herbal remedies, diet, exercise, and massage are used to restore the qi. China has been successful in promoting its therapies with more research and science-based approach, while Ayurveda still needs more extensive scientific research and evidence base. Let's look now at the Native American medicine. Native American medicine refers to the combined health practices of over 500 nations. The specific practices varied among tribes, but all of them are based on the basic principle that man is part of nature and health is a matter of balance. The natural world thrives when its interrelations are honored, nurtured, and kept in harmony. The natural world cannot be seen by the eye, and it's not involved in technology, but it is experienced directly and intuitively. Native American elders, medicine men or women, shamans, usually do not share their knowledge for fear of exploitation. Native American medicine addresses the balance in the inner life and outward behavior. The body, mind, spirit, emotions, social group, and lifestyle are all taken into account. Native American medicine practitioners also believe that the shaman obtains knowledge from a higher power during a trance-like state, which is accompanied by chanting, drumming, dancing, and in some cases consuming psychoactive botanicals. The knowledge allows the shaman to determine the cause and remedies for the sick person. The patient's choice and preference are always honored to create harmony. Each Native American healer has their own approach and can include bodywork, bone setting, midwifery, neuropathy, hydrotherapy, and botanical and nutritional medicine. Ceremonial and ritual medicine are also included. Much of this has been lost as this undocumented living tradition has only survived through living practitioners. More Native Americans have become interested in preserving their culture, and through this effort, Native American medicine is as fluid today as ever. We will look now and we'll try and compare and contrast those two types of medicine. And let's see, while the Western medicine believes that health results from normal physiologic function, the alternative medicine believes that health results from harmony among the person, his or her environment, which is the nature or the universe, and the energy force. The Western medicine will focus on treating illness or injury, very, very focused, while the alternative type of medicine will focus on maintaining a healthy state. While the Western medicine will correlate symptoms with an organ or location of the person's disorder, not the other type, the alternative medicine, will not correlate the symptoms of the disease with any specific zone or anatomic location. We'll see in a holistic way. The Western medicine will rely on manufactured pharmaceuticals, while the alternative medicine relies heavily on medicinal plants. Western medicine demands scientific evidence for the mechanism of treatment and replication of efficacy of the treatments, while the alternative medicine will accept that the treatment approach is based on traditional use rather than a science. The Western medicine will require practitioner to have a type of formal education beyond college, while the alternative one do not have any established educational standards for their practitioners. The Western medicine is highly regulated and requires formal licensure for practice regardless of the level of the practitioner, while the alternative medicine is totally non-regulated practice. While Western medicine will not reject spirituality, it is not applying it and doesn't believe in the religious significance. The alternative medicine do incorporate religious principles. While the Western medicine will recognize cultural differences, they will not incorporate that much or in a high extent the client beliefs into the treatment regimen. However, the alternative medicine identifies with and are sensitive to cultural traditions. The National Center for Complementary and Integrative Health, NCCIH, is part of the National Institute of Health and is the federal government's lead agencies for scientific research on the diverse medical and healthcare systems, practices, and products that are not generally considered part of the conventional medicine. NCCIH was formerly known as the National Center for Complementary and Alternative Medicine. To accomplish its mission, the NCCIH has identified 5 strategic plans, and those will be to advance research on body and mind interventions, practices, and disciplines, to advance research on natural products, formerly referred to as biologically based practices, such as herbal medicines or botanicals and probiotics, to address the gaps in scientific evidence and public information on the effectiveness of alternative therapies and their outcomes on safety, to bring together qualified experts from various alternative therapies and the biomedical sciences to carry out research, to develop and disseminate objective and evidence-based information on alternative therapies. And despite the absence of empirical evidence for the efficacy of some alternative therapies, the principle of first do not harm prevails as well. That is, if the alternative therapy is not dangerous or unhealthy, well, it should be tolerated or even supported if it provides something perceived by the individual as being beneficial. NCCIH's areas of interest will include both mind and body practices and natural products using complementary health. Mind-body medicine techniques that are administered or taught by a trained practitioner such as acupuncture, massage therapy, meditation, relaxation, spinal manipulation, and yoga. They will include natural products, which may be diverse products derived from plants, bacteria, fungi, animal species, and marine organisms that may include vitamins, minerals, and probiotics. The center's current top scientific priorities are as follows: non-pharmacologic management of pain, neurobiological effects and mechanisms, innovative approaches for establishing biologic signatures of natural products, disease prevention and health promotion across the lifespan, clinical trials utilizing innovative study design to assess complementary health approaches and their integration into healthcare, and communication strategies and tools to enhance scientific literacy and understanding of clinical research. Most mind-body interventions, such as biofeedback, imagery, humor, hypnosis, and spiritual healing, have few physical risks and can be taught or easily explained and have provided evidence of positive effects. Another category related to mind-body medicine pertains to techniques that focus on structure and systems of the body, including, let's say, bones and joints, soft tissue, circulatory and lymphatic systems. And some examples will include massage therapy, reflexology, shiatsu, chiropractic, yoga, tai chi, reiki, and acupuncture. If you are unfamiliar with any of those modalities or are interested to understand a little bit more in depth how they act, how they help, please look them up for a greater understanding of the basics. Let's see how some of those techniques are helping, and most of the times they are relying on the power of the brain, emotions, and social interactions to provide their effects. Let's see how biofeedback is used. Currently, is used in the United States to reduce hypertension and rapid heart rates, manage pain, abort seizures, relieve migraine headaches, and to produce dilation of peripheral blood vessels in individuals with vascular disorders. The American Academy of Pediatrics in 2013 endorsed biofeedback as a method for helping those with attention deficit hyperactivity disorder, or how you know it, ADHD. And it's been shown that in those patients, biofeedback will alter the typical EEG patterns to a more focused, attentive state. What happens with imagery? Well, during imagery, your client will visualize positive physiologic effects. And for example, your client is using imagery to wage war with their disease by an army of white blood cells. And it has been shown to have as an end result and significantly more white blood cells after imagery than before. Humor. Laughter will stimulate the immune system by increasing the number of white blood cells and by lowering the cortisol, which in compensation will suppress immune function. Laughter can cause the release also of neuropeptides as endorphins and enkephalins. Question number 2. Which of the following has been known to achieve benefits for clients with cancer, through the use of the mind to visualize a positive physiologic effect. A. Imagery. 2. Hypnosis. C. Humor. Or D. Biofeedback. Correct answer is A. Imagery. And imagery is a psychobiologic technique that uses the mind to visualize a positive physiologic effect. The amount of scientific evidence on dietary supplements will vary widely, and there is a lot of information on um, some and very little on others. Whenever you need to take a supplement, you need to consult with your physician. And this is extremely important, especially if you're planning surgery or are taking any kind of prescription medication. A great deal of research has been done on probiotics, however, but much remains to be learned about whether they're helpful and safe to quite a lot of the health conditions. So probiotics have shown promise for a variety of health purposes, including prevention of antibiotic-associated diarrhea, including that caused by Clostridium difficile, prevention of necrotizing enterocolitis and sepsis in premature infants, treatment of infant colic, treatment of periodontal disease, and induction or maintenance of remission in ulcerative colitis. However, in most instances, we still don't know which probiotics are helpful and which are not. We also don't know how much of the probiotic people would have to take or who would be most likely to benefit from this type of treatment. Even for conditions that have been studied the most, researchers are still working toward finding a common ground, the answer to all those questions. Aromatherapy is the use of essential oils from plants, flowers, herbs, or trees as a complementary health approach. The essential oils are most often used by inhaling them or by applying a diluted form to the skin. Many essential oils are used in aromatherapy, including those from Roman chamomile, geranium, lavender, tea tree, lemon, ginger, cedarwood, and bergamot. Aromatherapy is sometimes used for insomnia, but we don't know whether it's helpful because little rigorous research has been done on this topic. Apitherapy, or the use of the bees in healthcare. Bee sting or bee venom therapy, which involves placing live bees on certain parts of the body and allowing them to sting, seems to have no effect on either multiple sclerosis symptoms or on the disease progression. And this is pretty much the only condition that the bee venom was ever studied on. Question number 3. Why is obtaining information from a patient related to the use of herbal supplements during a nursing assessment important? A. Some herbs may interact with prescription medication. B. Nurses have special knowledge related to herbs and supplements. C. Herbs and supplements require a written prescription. Or D. The herb or supplement may need to be acquired from another country. The correct answer is A. Some herbs may interact with prescription medication. Some herbs, as said, and supplements may interact with prescribed medication, so the nurse needs to document the herbs and supplements that the patient reports taking. We'll discuss now the manipulative and body-based therapies. The manual treatment methods used by chiropractors will range from stretching and sustained pressure to specific joint manipulations, all of those usually delivered by hand, and it will involve a quick and gentle thrust. The purpose of the manipulation is to improve joint motion and function. Manipulations are most commonly done on the spine, but other parts of the body may also be treated in this way. There is much debate about whether this is helpful or not. Massage therapy, NCCIH-sponsored studies have investigated various aspects of massage therapy, including whether massage therapy can be helpful in preventing and treating repetitive motion disorders, or if massage can be helpful as a component of a non-drug approach to pain management in veterans, if massage therapy can target sensory pathways that can help people with ankle sprains avoid chronic ankle instability, which in fact can affect up to 40% of the people after this type of injury. Yoga is an ancient and complex practice that is rooted in Indian philosophy. It began as a spiritual practice but has become popular as a way of promoting physical and mental well-being. Although classical yoga also includes other elements, yoga as practice in the United States typically emphasizes physical postures, asanas, breathing techniques, pranayama, and meditation, dhyana. Popular yoga styles such as Iyengar, Bikram, and Hatha Yoga focused on these elements. Yoga and two practices of Chinese origin, Tai Chi and Qigong, are sometimes called meditative practices. All three include both meditative elements and physical ones. Studies have suggested possible benefits of yoga for several aspects of wellness, including stress management, mental and emotional health, promoting healthy eating and activity habits, sleep, and balance. Let's discuss a little bit about reflexology. Reflexology practitioners and the Professional Association have advocated that reflexology is effective for general well-being maintenance and treatment of chronic diseases such as strokes, musculoskeletal disorders, and stress. Due to its soothing, massage, and non-drug complementary nature, reflexology is widely accepted by general public. Yet numerous systematic reviews confirm that strong evidence of the positive effects of reflexology post-intervention are lacking, despite plenty reported small-scale trials and anecdotal evidence of reflexology for some common ailments. Adequate training and practitioners and reflexology program accreditation are to ensure correct and consistent services can be provided to the public. Reiki will involve the manipulation of electromagnetic fields in the body. So Reiki is a complementary health approach in which practitioners place their hands lightly on or just above a person with the goal of directing energy to help facilitate the person's own healing response. It's based on an Eastern belief in an energy that supports the body's innate or natural healing abilities. Reiki hasn't been clearly shown to be effective for any health-related purpose. It has been studied for a variety of conditions, including pain, anxiety, and depression, but most of the research has not been of high quality and the results have been inconsistent. Reiki hasn't been shown to have any harmful effects on the other side. Research studies don't support the use of static magnets for any form of pain. Electromagnets may help with osteoarthritis, but it's unclear if they can relieve the pain enough to improve quality of life and day-to-day functioning. And this is a result from 2013. So in the same year, in 2013, the US Food and Drug Administration approved a device that using strong electromagnets to treat migraines and depression by stimulating nerve cells in the brain, a process called transcranial magnetic stimulation, TMS. And TMS may help other pain conditions in the same way as well. Acupuncture. This is a healing therapy in which a needle is placed in one or more meridians, pairs of energy pathways throughout the body to unblock chi. Acupuncture is considered a form of energy therapy because its ultimate goal is to restore the balance and free flow of energy in the body. Some acupuncturists take the technique one step further by manipulating the needles with an electrical current. When used in this manner, it is referred to as electroacupuncture. There have been extensive studies conducted on acupuncture, especially for back and neck pain, osteoarthritis, knee pain, and headache. Question number 4. Which type of complementary health practice believes that reprogramming the neural reflex improves the body's ability to facilitate natural healing? A. Shiatsu. B. Reflexology. C. Yoga. Or D. Chiropractic. The correct answer is B. Reflexology. Reflexologists believe that reconditioning or reprogramming the neural reflex improves the body's ability to facilitate natural healing. Now, because nursing is a holistic practice, it is essential to integrate both conventional medical therapies and the alternative techniques that have demonstrated beneficial evidence-based outcomes. For those techniques that are still investigational, the nurse should teach the client regarding potential risks. However, it is important to respect and advocate for a client's choice of non-traditional medicine in combination with a conventional medical treatment as long as there is no potential for harm. Nursing can play a pivotal role in assisting clients to make knowledgeable choices about their healthcare by learning about alternative therapies, by assisting the client to obtain full disclosure about potential treatment options, by examining research findings to determine the benefits and risks of alternative therapies, by empowering clients to assume autonomy for healthcare decisions, by supporting clients' choices as long as they are not potentially harmful, by preparing for possible untoward effects that may occur with non-traditional techniques, and by avoiding the implementation of interventions that violate the legal scope of nursing practice.